Well, first and foremost, we're going to take the unreasonable cap off of the safe injection sites or safe consumption sites that Doug Ford put on here in Ontario. We also have plans to make sure that we have detox beds boosted. You can't get into a rehab bed without a detox bed, and so detox beds, rehab beds, getting people to a place where they can safely consume. In the first place, we know that police chiefs are calling for decriminalization at the federal level. We support that call. We also know that there are folks that within the healthcare system that are flagging the poison drug supply. We need to have serious conversations about that as well. Folks who are experiencing addictions need to have some support to try to help them find a way out of that space. And we are not going to do it by taking away services or by capping services. We're going to do it by making sure the services are there for people when they need them.
It is deeply disturbing to see what's happening. We've heard from mayors, for example, right across this province about how challenging it is in each of their communities because they don't have the funding in place or the support or the partnership or collaboration from the Ford Conservatives. So just a couple of things. We've included, I believe it's $300 million, but I'll double check and we'll get back to you on those numbers, for direct funding for more support going out to make sure that we are able to provide, for example, the fentanyl strips and a series of other measures that the naloxone kits and everything else, so that from pharmacies to public health to other public venues that they're available. The opioid emergency task force that was struck a number of years ago. Keep this in mind. While the opioid crisis has only gotten worse, that task force hasn't met a single time in 4 years. Not a single time. Not a single time. We will reactivate that task force. We have a significant plan to build out deeply affordable and truly supportive housing here in Scarborough and right across the province of Ontario, thousands of new units. With the funding in place, I believe it's $360 million in new money that we will invest in the community and social services that need to be built or included around those housing units that we're talking about. So these are just some of the examples of how we would go forward to work with our municipal partners and community organizations to make sure that we are confronting the opioid crisis. It is a tragedy.